We know that now the number of preterm-born individuals is continuing to rise, and actually in the so about 10% of babies now are born preterm. But there's very little known about what impact this is actually having in the long term and what changes in cardiovascular phenotype of these individuals. There was a big change in the demographic of preterm-born individuals about 30 years ago with the improvements in clinical care, so there's a lot more low birth weight preterm-born survivors now that are younger gestational ages that are now reaching young adulthood. So what the public health implications of this are, we're not exactly certain, but we need to first look at the actual changes and quantify those changes and then to determine which factors may be driving those changes in the preterm-born populations. One of the advantages of this study is that it's a follow-up study of preterm-born individuals that were actually recruited in the 1980s with detailed perinatal characteristics. So they were actually recruited at birth and they were in intensive care for up to 9 weeks postnatally. These were all extremely or very preterm-born individuals, so they were born less than 33 weeks gestation. So they are actually born during a period of vascular and cardiac development. We've looked into things such as blood pressure at the moment and shown that there's about an 8 millimeter difference in systolic blood pressure between preterm-borns and term-born individuals. And we've also looked into blood pressure variability with 24-hour monitoring and shown quite a large difference between the preterm-born and term-born individuals. And if this magnitude of blood pressure elevation continues to track into later life, is quite significant. They have differences in biochemistry measures and actually quite large changes in cholesterol elevation in the preterm-born individuals. They have a slight increase in arterial stiffness and a statistically significant increase in left ventricular mass, again, which falls into the hypothesis and that this is an interruption in and potential accelerated maturation in these preterm-born individuals, which again will increase their risk of cardiovascular disease if it continues to persist into later life.